So I've arrived here again. It's Monday. It's day 4 of my treatment here at the FE hospital. Today I am having physiotherapy and rehabilitation. Tomorrow, Tuesday, starts my first round with my personal trainer who is responsible for doing my muscle building and cardio with me. Now I'm here again. I'm having physiotherapy and rehabilitation with Lynn and Kim. It's 3 p.m. on Monday. It's 31 degrees. It's absolutely beautiful here in Saigon. I find the heat is much better for my lungs. I do way worse when I'm trying to breathe in cold air. I'm excited now again today because the amount of stuff they teach me every single session I have is fantastic. Sunday, I went to Golden Lotus World, the Korean health spa, for the Jim Jin treatment. I participated in the salt room, the Japanese pinene room, the volcanic room, infrared sauna, red light therapy, and the hot and cold foot pools for circulation. In Jim Jin is fantastic. Yesterday I went. I'm going to go twice a week now, every week while I'm still here. I'm going to participate in all of the different rooms. All of them have different outcomes, and they're for different things. I've picked the ones that suit my symptoms, and I'm doing them for that. For inflammation, the red light therapy. For my lungs, I'm doing the Japanese pinene room and the volcanic room and the dry salt room. For just general, basically inflammation again, I am doing a dry sauna because I can't handle the heat and wet in regular saunas. And the circulation boosters were fantastic. I didn't know whether I'd like them or not, sticking my feet into a cold pool, but it's actually not as bad, cold, hot. It actually worked out really well. Of physiotherapy and rehabilitation, girls are fantastic again. They went through the belly breathing with me, then they did the stationary bike with me and ensuring that I know how much exercise I'm actually to do. They kept monitors on my pulse ox and my heart rate and my blood pressure during the entire thing. Everything seemed to be looking good. I was holding good with my oxygen levels, maybe 92, which is good enough for me. I felt fine during the exercises. I'm not too tired after them, and I don't feel sick. Pain during the physiotherapy session, I wasn't too tired performing it. And the rehabilitationist worked on my inspiratory and respiratory muscles again. The physio then was working a lot on my neck muscles as well, because apparently I'm doing this because my chest is hyperinflated. I didn't realize how bad it was until I lie down and I can see that my body is bowing up. It's Tuesday here in Vietnam. I'm getting ready to go to my first session of personal training this afternoon. My pulmonary consultant told me to take up wind instruments. So this morning I have been at the flute. I've practiced for 15 minutes and I'll practice every day for 15 minutes. Am I musically talented? No. Am I quick study at the music? No. But I will practice every single day. So I've just come out of my first session there with Kong, the personal trainer that the hospital recommended to me. It was fantastic. He was well able. He knew exactly what was wrong with me. He wasn't worried about hurting me or anything like that. He basically just ran me through the exercises and was really patient and explained me what to do. They also did a full body composition scan here and gave me all the results. So Hong, the trainer, now sent me a full meal plan designed for my COPD. He also sent me all of the exercises yesterday on email so that I can have them and print them and be practicing again. I have him 3 times a week. He was recommended by the hospital. He knows exactly what's wrong with me. He's specially trained to deal with people who have medical problems. So I've arrived here again at the FE hospital. It's 1 o'clock on Wednesday. It's 31 degrees. I have physiotherapy and rehabilitation with Lim and Kim again today. On Monday evening, I was walking along and I tripped and I fell. I've had a pain in my chest since. I'm not sure if I've hurt myself, a muscle strain or something, or if I'm having a flare-up. I rang the hospital this morning because I was quite in a lot of pain last night. They said that this morning that the pulmonologist will come down to see me and clear me before the rehabilitation and physio today. At least then I know whether I'm going on my antibiotics or my rescue pack, or if I just have a muscle strain. I also want to talk about my personal trainer, Hong. He's absolutely brilliant. He's very, very enthusiastic. I am the first Western female that has been referred from the hospital to him. So overnight he has spent making up programs for me. He keeps sending me encouraging text messages, even though yesterday when I did the session, I didn't think I did that well at it. And afterwards, he sent me this big message about how well I had done and how my stamina and endurance was a lot more than he was actually expecting. That was really nice to hear, because sometimes you think that no matter what treatment you're having, that you're not doing that well at it. So I practiced the flute again this morning, the tin whistle. I'm not very good at it. The poor Vietnamese that had to listen to me, God bless them. But I will do it every single day for the 15 minutes. Tomorrow now, I have to go to a voice training lesson to learn how to sing. Basically, the singing is just about controlling your breathing again. I cannot sing. I probably can't even hold a tune. Quote, it's all about how I'm breathing. So I'm here now again at physiotherapy and rehabilitation this morning. I actually wanted to talk about the cost of Hong. Hong, the personal trainer, is doing 12 sessions over a month for 390,000 dong, which is 120 euros. So each session works out as 10 euros per session. So I'm just out now of the FE hospital. When I went in, the pulmonologist was waiting for me. He checked my lungs. He sent me down to have a chest x-ray. An orthopedic doctor was there to check that I hadn't broken any of my ribs. And it turns out that I had pulled a muscle between my fourth and my fifth lung. Then I was sent to physiotherapy and rehabilitation with Lynn and Kim. They both knew that I had a small bit of pain and they worked on it. And I actually feel way better right now. The pain is way less since I walked in there. They've given me stretches to do at home this evening to help with that muscle pull in my chest. The service here is fantastic. So the x-ray, the two doctors cost me 79 euros. And then I paid 16.80 for Lynn and Kim for the physio and the rehabilitationist. So it's Friday here now, and yesterday I was very tired. I did do the personal training with Hong. We did a load of stretching and some walking because I had pulled the muscles in my chest on the day before. Morning here now, and I've done the tin whistle and I've also done a voice training lesson, and at 20 to 2 I have physiotherapy and rehabilitation at the FE hospital. I'm starting to feel really good about it all. Everything is going well. I'm able to perform all the exercises. I wasn't sure if I'd be able to. Obviously, my body is starting to feel it. My muscles are sore and I am tired. I have pain and I have shortness of breath. But I have pain and shortness of breath anyway. So I'm not even that concerned about that. I feel better. My muscles starting to feel a bit stronger. So I've arrived here now at the FE hospital again. The car just dropped me off. I'm really tired today. I have to do physio and rehabilitation. I hope that they don't work me too hard. I presume then afterwards I'm going back into town, having dinner and going to bed. I am feeling it this week. It is an awful lot. It was very intensive, but I do starting to feel better. I'm very grateful to the whole team out here in Vietnam and to the team at the FE hospital. I've had the most fantastic service by them all. I'm very happy with it. I'm delighted that I made the decision to come, even though people said I was crazy and I was this, that, and the other for going across the world for this. My options were to sit at home alone in my apartment, afraid of infection, afraid of everything, and waiting on public waiting lists for over 2 years to have rehab and to even see basic doctors like cardiology or gastroenterology. Enterology. Again, now it's 30 degrees here today. I'm doing really well in the heat. I'm not affected by the humidity. I'm not affected by the heat. I found it way harder in Ireland in October, November, December to actually breathe at home. I was more concerned about going outside. I was concerned about everything. Here, I just put on my mask. Out I go. Everyone's wearing masks. No one's staring at me. No one's making me feel anything about it. I want to hear to talk about my medicine compliance. I'm fully compliant with all the medicines and inhalers and what the doctors gave me. I'm also taking a full range of vitamins and minerals, and I had a full round of vaccines: pneumonia, COVID, flu. They're all my personal choices to do these because I feel that they're making me feel better. They also help me reduce my anxiety by hoping that I won't get those diseases, or if I do, that they won't affect me as much as they could. I also take protein powder every day. I'm trying to hit 130 grams of protein, so I bought the protein powder from Ireland so that I could ensure I'm doing it. I'm finding it easy with the food out here. There's loads of Western food, there's loads of Asian food. It's up to yourself what you want to eat. The food is fresh out here. Markets are done every day. You can have what you want. I'm also having my electrolytes every single morning mixed in with my pineapple juice. So it's Saturday morning here, and I'm preparing now to go to personal training again. It's been a lot this week. Yesterday I came home from the physio session and I was very tired. I fell asleep at 5 o'clock yesterday evening. I just couldn't stay awake. I was exhausted. And today now I'm finding it a little much. I'm still going to go out and give it all my all and hope for the best. I presume that when I come back in a couple of hours that I'll be extremely tired again and that I'll go straight to bed. I've just come out of the gym now here in District 7, and today now he worked on muscle building on my upper body. He also put me on the treadmill. We practiced the belly breathing, and I was very happy with this session. I was very tired beforehand. I am tired now. I'm going to go home and have a nap. Sunday morning here. It's been a long second week. Week 2 was very, very intensive. Having to do either physio and rehabilitation or personal training 6 days this week was a lot. I found myself Friday and Saturday extremely tired. I came home yesterday after doing the training. I got through it. I did all the exercises and I had some food and I went to sleep. I'm just finding it very hard at this stage.